You know, choking is a terrifyingly silent emergency. It can happen anywhere to anyone in an instant. In just the next few minutes, you're going to learn a skill you hope you never, ever have to use. But if you do, it could absolutely save a life. So let's get right into it.
So picture it, right? You're at a restaurant, maybe a family dinner, and someone at the table suddenly goes silent. They can't breathe. It is a scary moment for sure, but panic is not an option. Knowing the right steps and knowing them cold can turn that potential tragedy into a life-saving rescue. So, we've broken this down into 4 really simple, easy-to-remember parts. First, we'll talk about how to recognize a real choking emergency. Then we'll get into the technique itself, abdominal thrusts. We're also going to cover a really important adaptation for pregnant women. And we'll finish with the one step that so many people forget, the crucial follow-up. All right, first things first. How do you actually know if someone needs your help? I mean, really needs it. When an airway is completely blocked, the signs are totally unmistakable. And spotting them right away is the first critical step.
Okay, so this is the key. If a person is coughing or making any sound at all, their airway is only partially blocked. Just encourage them to keep coughing. But if you see these 3 things, they can't cough, they can't breathe, and they can't speak, that means their airway is completely obstructed. That's your signal. That's when they need your help, right now.
Now, before you do a single thing, you have to ask. You got to look them right in the eye and ask directly, are you choking? They're probably going to nod yes. Then you say, with confidence, I know how to help. May I help you? For a conscious adult, getting their permission, even just a nod, is so important. It confirms what's happening and it establishes you as the person who's about to help. Okay, so you've confirmed it, you've got permission. Now for the most important part, the actual skill. Let's break down the exact technique that can save their life. We're talking about abdominal thrusts, sometimes called the Heimlich maneuver. Let's walk through this together. You're going to get into a nice, stable position right behind them. First, find your landmark. Find their belly button. Easy. Now make a fist and place the thumb side of that fist just above it. Wrap your other hand firmly over that fist. This is your spot. Now you're going to perform sharp, forceful thrusts. And here's the deal. You don't stop. You keep going until that object comes flying out or until the person becomes unresponsive. And this says it all. The motion is everything. It's not just a squeeze, not at all. It's a sharp, deliberate movement, inward and upward. Think of it like a J motion. You're basically using the air that's already trapped in their lungs as a piston to pop that obstruction right out. It's that specific motion that makes this whole thing work.
Now, it is absolutely vital to know how to adapt this skill for special situations. The most common one you'll encounter is pregnancy. You're essentially helping 2 people at once, so the technique has to change to keep them both safe.
The idea is the same, but the location is totally different. For a pregnant person, you stay away from the abdomen completely. Instead, you're going to place your fist right in the center of their chest, on the breastbone. And look, the direction of the thrust changes too. Instead of that inward and upward motion, you're just going to do sharp thrusts straight inward. This protects the baby while still doing the job of clearing the airway.
Okay, the object is out. They're breathing again. Everybody's taking a huge sigh of relief. But listen, your job isn't quite over. What you do next is just as important as the rescue itself.
And this part is absolutely non-negotiable. I don't care if they say they feel perfectly fine. After any choking incident that required abdominal thrusts, that person has to be checked out by a medical professional. That means calling paramedics or getting them to an emergency room.
And here's exactly why. For one, a little piece of whatever they were choking on could still be down there, causing a partial blockage. 2, a doctor needs to listen to their lung sounds to make sure everything is truly clear. And 3, let's be real, those thrusts are powerful. A checkup is absolutely necessary to make sure there's no internal injury.
So, we've walked through how to see the signs, how to do the skill, how to change it for pregnancy, and that all-important follow-up. These simple steps, if you can just lock them into your memory, will give you the power to act and act correctly. So the only question left is, if that moment ever comes, are you ready?